Last year we had about 10 cases here in Lake County. Our incidence is about average for the state of Illinois. We are a bit higher than some of the rural communities to the south, but we have many less cases than, say, Cook County or Kane County, where there was an outbreak last year. Tuberculosis is caused by a bacteria, which is a bit unusual for bacteria in that it has a waxy coating, which makes it very hardy and difficult to destroy. It lasts for long periods of time in the environment. And it can be airborne, and this is generally the way tuberculosis is spread. It's airborne. This usually occurs in closed spaces, auditoriums, buses, trains, malls, places like that, where people who have tuberculosis cough the organism into the air, they remain airborne, and someone else can inhale them. Latent TB is a situation where you have the bacteria in your body, but it isn't causing any infection as of the moment. A TB disease, we say, is when the actual infection is damaging lung or other body tissues. If one is in the latent phase, he is or she is not contagious. The bacteria are not exhaled or coughed out, and they're no risk to other people. And so when we have these people, we will treat them to prevent the emergence of disease in certain situations, but they need no restrictions. When you have tuberculosis disease, however, if it's in the lung, then you are at risk of transmitting this to other people. Tuberculosis in other organs of the body are not contagious. Anyone can get it, but the highest risk is in those whose immune system has been suppressed. Those could be cancer patients, especially if they're on chemotherapy. Certain types of rheumatoid arthritis and other arthritides are now being treated with immunosuppressive agents, injectable, that cause a susceptibility to tuberculosis. Crohn's disease is another entity, and especially those with HIV infection, who naturally, because of the infection, have an immune suppression problem. These would be the highest risks, though anyone can get it. The standard skin test, or there's a blood test also for tuberculosis that we use to to check whether or not one has been exposed to tuberculosis, is worth doing for people if they have a high-risk occupation. In other words, areas where they're working with people who might have tuberculosis. There's very little that you can do when you're breathing in the air except to wear a mask, which is sometimes done, and we sometimes recommend for people who have an immune suppression problem or something like that. But for the general population, avoiding the areas, being tested periodically if you're in an area where there's a high risk of your acquiring TB are the usual ways. Call us here at the Health Department TB Clinic. The number is 847-377-8700. And depending upon the question, they can either answer the question, they may bring them in for a visit with one of the nurses, or schedule an appointment with me, depending on what's appropriate.